will you tell us about how uninsured people don't get treated well? And I can tell you, I'm one of those people because I'm not insured. So the first thing when I walk into a hospital or whatever, and they ask me about insurance and I don't have it, they look at me like they get a sorry face, and it's like, oh, I'm so sorry. And it's like, no,
Yeah.
this is great news. I'm going to pay you today.
So it was my brother-in-law. His father was really sick and did not get treated super well in my brother-in-law's eyes. And so he kind of always had this negative mindset when it comes to traditional healthcare and going to the doctor and preventative medicine and sort of all those sorts of things. And so when he had a pain or an issue, he would just pop some ibuprofen. And so he did that a lot for many years. And then he started having pain. And so he obviously didn't have a primary care provider because he didn't trust the system. And so when things started going kind of bad, he presented to the ER with this sort of vague pain. And this was, 20 years ago. So it was kind of at one of those times where ERs were getting in trouble and providers were getting in trouble for not addressing pain properly. And so they thought that he was more of an opioid pain medicine seeker, and
Mm-hmm.
they really didn't give it much more thought. They prescribed him, his 30-day supply of opioids and kind of pushed him out the door. And he was adamant about, no, there's something going on, but that, it just didn't work out. So the next day he got worse. He presented to a different ER. This was in a different state. This was out in the Midwest. And yeah, kind of the same story. And then, of course, now they look at him because he went to a different ER the day before. And
Mm-hmm.
so now he's doctor hopping and drug seeking. And so they, of course, gave him a couple more pills and sent him on his way. And so the next day, finally, I think that's when the straw kind of broke the camel's back, and he went to a different ER presenting with the same symptoms, just worse. And this time he jumped the border and went to Wisconsin instead of Illinois. And they did some blood work and they did some tests and showed that his H&H, so his hemoglobin and hematocrit, some of his blood levels were extremely low, and they started urgently giving him blood and plasma and all these different things. And they admitted him because he ended up having a giant duodenal ulcer that started bleeding, and he was literally dying. And it was an easy fix when it comes to fixes, I suppose. They gave him some blood and some medicine to kind of stop bleeding, and they watched him and, of course, stop ibuprofen
Mm-hmm.
usage. And so it was more a lack of education and a lack of access to care with somebody that he trusted. But it really almost cost him his life. And the biggest part of that is, yeah, we grew up poor, and we didn't have insurance, not because it was a choice, but it was because we really couldn't afford it. And so when they looked at him, they thought, that's what they thought. And it was just a really unfortunate situation. And so growing up with that and knowing that, I'm a healer and I want to help people, it was just part of that drive to make sure that, gosh, that doesn't happen to anybody that I'm taking care of.